There's also the opposite functionality, which is the pressure that you're pushing against, which is the afterload. So what situations might the afterload increase, which also means that you have a high ESV left over? Aortic stenosis, chronic hypertension, an acute increase in systemic vascular resistance due to giving something like phenylephrine, which is a peripheral vasoconstrictor, narrows all of your peripheral vessels. Now let's talk about the beneficial situation, or a situation in which end systolic volume is reduced. In what situations would end systolic volume be reduced? When you have good contractility, when you have good sympathetic stimulation, when you are using an inotrope, when you're using dobutamine, when you're using digoxin. So exercise, sympathetic stimulation, all of these things increase contractility of the heart, but reduces your end systolic volume, which is exactly what we want. Another interesting thing could be like ACE inhibitors, ARBs, some of these drugs that cause vasodilation peripherally, which will reduce your afterload, which is the pressure that the left ventricle has to push against. Sepsis can reduce your systemic vascular resistance peripherally. So all of these things, hyperdynamic circulation. So what are the key things that we need to figure out? We need to remember how afterload affects end systolic volume. We need to remember how contractility affects end systolic volume, and we need to know how preload. So increased afterload will also increase your end systolic volume. Both bad for the heart. Increased contractility will reduce end systolic volume, something we want for the heart. And then increased preload, it doesn't directly implicate on ESV or end systolic volume levels. So the specific scenarios that might come up that are going to increase your end systolic volume, it could be a post-myocardial infarction patient who has a sudden decrease in contractility, meaning the ESV goes up, the ejection fraction suddenly goes down. Another situation which ESV and systolic volume could go up is aortic stenosis, and that would be through increased afterload. And another last situation would be a beta blocker overdose. So when you overdose on a beta blocker, you are suddenly reducing the cardiac contractility. And when you're suddenly reducing the cardiac contractility, your end systolic volume is going to go up. So those are the three situations in which your end systolic volume goes up and you have reduced contractility or increased afterload. What happens with dobutamine infusion? Now you have increased contractility. You're able to get that blood out of the heart, and you're going to have a reduced